السلام عليكم ورحمة الله وبركاته. I'm Hamid Al-Bouardi, a medical student at the National Guard University and a proud member of this amazing Saudi bipolar community. I've been diagnosed before I could remember and lived my life with the disorder. But less about me and more about our brilliant guest. Today, we're honored to have a great guest who is a specialized social worker and the owner of Recovery Now in New York. Mr. Max Guttman, also known for J. Peters in his books, is a therapist and a disability rights advocate. He's also the editor in chief at the Mental Health Affairs. While there, he wrote many articles about psychosis and schizoaffective spectrum disorder, which is simply put, a merge between schizophrenia and bipolar. It's a pleasure to have you here, Mr. Guttman.
Thank you. Thank you. It's a pleasure to be here. You know, hearing about your experience a little bit, and all the people out there that have their experiences, right? We want to make sure that those people out there have the information that they need. That's really, I think, of everything they do. I wear a lot of hats, like you said, author, rights advocate, therapist. But my goal, really, in essence, is to get people the information they need to live the lives that they can most comfortably and in the most empowered way possible, so they're not out there struggling. So their illness and their symptoms don't become a source of you know um, anguish. And they can understand what's going on with them in real terms, and get the tools that they need to live in their lives without interruptions, without fear, without despair. And part of how I do that is has been my journey too, like yours. And my journey began actually in high school. And I wrote about it in my one of my books, Wales High School. But making a long story short, I was experiencing symptoms of a mood disorder, and it was bipolar disorder, or then, and like you said, these are spectrum disorders, and it really, in my opinion, all diagnoses, right? A lot of them really are spectrums, um, you know, um,
I'm sorry to
because
interrupt, but you say spectrum. What do you mean by spectrum?
so like by spectrum I mean, so you have schizoaffective, right, disorder, which is a mix between, like you said, bipolar disorder and schizophrenia. But along the spectrum of symptoms and reacting to the symptoms, some folks have more disorder than they do psychotic symptoms. And along the spectrum, right, because that goes back and forth, people experience their diagnosis in a very different way. Everyone experiences their symptoms very individually. So while diagnoses are great for clinicians, to pass information back and forth and make sure that people are getting the right treatment fit, they're not always the most helpful for people understanding their disorders. People get very caught up in labels. No, I have this versus that. I have bipolar versus schizoaffective, schizoaffective versus schizophrenia. And really, the truth of it is, you have um, complexities due to mood dysregulation and thought disorder, and where you fit on this spectrum is so individual, and it really, frankly, doesn't matter. What matters is how you experience your symptoms and what you do to get treatment and self manage. So these labels are can be very helpful for clinicians, but sometimes they can be very disempowering and very you know very confusing for people to understand what's going on with them. People have to understand what the issue is for them. And for me, in high school, it was more mood disorder. But when I got to college, the mood disorder component took a back seat to the thought dysregulation. I got very psychotic, extremely psychotic. And the problem then wasn't the mood piece so much as it was my thoughts that were so unclear and so dysregulated that that's what threw me in the hospital. A lot of folks can live with mania and a lot of these mood disorder components without necessarily going into the hospital unless it becomes a problem for them. Sometimes it's that new that new symptom that's activated that throws them in the hospital because they don't know how to deal with it. Right? People could also be out there. Are people out there that have treated for years that are floridly psychotic that live in the community. The reason why they don't end up in the hospital is because they don't have this new symptom that creates such an issue that they become a danger to themselves or to other people, right? So
So
like you
what you
have
mean
people out
about
there.
so what you
Sure.
mean is that the new onset is the one that triggered the hospitalization,
A
or
lot
the
for most people, it's a new symptom that's confusing, that's troubling, that they don't know how to deal with it because it's new to them. And when you have a new symptom that's being activated, you have to know how to self manage, how to treat it, where to go, what to do. And usually that's the most troubling symptom, and that's what throws the entire clinical picture off and what sends people into free fall because they don't know, they were dealing with one set of issues and all of a sudden another comes and it complicates the picture so much that they become maybe perhaps a danger to themselves or others. Like for example, okay, I I was living. I knew in high school how to deal with mania and mood disorder and depression, but it wasn't until my psychosis was activated in college that I ended up in the hospital because all of a sudden I'm hearing voices, right? And I don't know what to do with these voices because I think that it's a how do you know what to do when they occur, unless you've dealt with it before. And a lot of people that first experience these symptoms will get thrown into a panic. They'll get thrown into a confused state, which leads them to an arrest, or wandering outside naked, or some sort of strange occurrence, which leads them to become more visible to police and other responders that would take them to the hospital. You know, a lot of us with mental illness, we've learned how to deal with it and self manage over time if our symptoms stay fairly the same. So like if you learn how to manage
controlled?
mania, yeah, controlled, managed over years, you don't wake up one day with mania and then wake up the next confused on how to deal with it. You've learned how to deal with it over time. And I've learned how to deal with a lot of symptoms over the years, and I've learned how to treat a lot of symptoms over the years. And my guess, what I'm trying to say is the best diagnostic measure for a person to understand themselves, and to communicate it with a clinician that's treating them, is really truly understanding your symptoms and what they look like and how they play out. Because I said labels are labels. You know, uh, Depression doesn't mean much, but being suicidal, right? Is it suicidal is a
Means a
behavior.
lot.
Depression is a behavior. Depression is a state of mind,
True.
right?
So
But
depression is a
you're
state of mind, but the suicidal is the behavior that you're
it's
talking
behavior
about.
because you're acting out. You're hurting yourself because you're so depressed. So the behavior is what's important. And when you understand your symptoms as thoughts that play out as behaviors, that's when you're really going to get a good idea on how to handle and self manage yourself. Once you know what thoughts lead to what behaviors and what those behaviors mean in terms of your everyday living, you're going to get a whole lot better idea on how to manage your everyday affairs and learn how to cope a whole lot better. You know, um, y- you know, uh, it's like people say, you can't live with schizophrenia. No, you can't live with something you don't understand.
Oh,
You live with these complex disorders if you get underneath what they mean for you in your life, in the implications, right? um People get very overwhelmed, um also with the long-term nature and the chronicity of these illnesses, and that's what's really so difficult, because for schizophrenia and some bipolar disorders, schizoaffective disorders, these are long-term illnesses. Then they're not acute. These are long-term chronic illnesses. And what becomes important is learning how to manage over the long term. You know, it's easy to deal with a headache, right? In the moment, you take a couple Advil, right? And it goes away. But you can't take Advil all the time, every day for the rest of your life, right?
but what about the medicine that you take for antipsychotics and mood stabilizers?
Exactly. So, you know, that's that Advil piece, right? So I take Abilify for my to handle and manage my schizophrenia. So what's nice about Abilify is, or what has been nice is it manages that mood disorder piece. My moods aren't unstable; they're not moving. I'm not getting too manic or too depressed. But at the same time, they clarify my thoughts, and you know, they disentangle them. They do whatever they need. It does what it does, so I'm able to think as clearly as possible. And
But do you
the
think the
only
medicine are the only drug, the only choice?
No, I
Do you think
don't.
that
And I
medicine?
think that no, not it's not the only choice, and it's also something that needs to be considered over the long term because you gain a lot of weight with Abilify. Okay, yeah, a ton of it. Um, and recently I tried to get off of Abilify. It's what led me to get hospitalized just a couple of weeks ago.
Oh,
Because yeah, because I switched over to Genome, which is in the same classification, but it's a little less
that's
powerful,
good.
and it's also an antipsychotic, but it's a little less powerful. And I got panic attacks because it wasn't managing my anxiety from my that I was experiencing from my symptoms. So what happened was I got so excited that I started panicking, and I didn't know what that was because with Abilify, my anxiety was managed. All these little components, and you know, I found so far to date that my symptoms have been so severe that I need a really significant amount of medication to keep them at bay. There are people that need less. There are people that could do without some meds. I know that for the more significant and more
Charity.
chronic illnesses, it's harder to deal with medication. It's harder to deal with these illnesses without meds. Think about okay. I want to give you an analogy. So think about an airplane, right? That's flying along. What happens when one engine goes out? It starts
Go
to
to the other side.
teeter, right? So think of that as your mood disorder for schizoaffective. Okay, one engine goes out, now your mood is off kilter. Then another engine goes out, and your brain goes, and you're psychotic. Now you're all over the place. Okay, so the more systems, right? Your mood, your thinking that go down, the more medication you're likely going to need to stabilize, right? When your car fails, right? It costs more money to fix it when more shit breaks, right? More stuff is broken, and it takes more medication to keep that car moving, or more oil, or more parts when more stuff breaks down. So,
So
like
a question we hear. I'm
yes,
sorry to interrupt, but a question we hear a
no,
lot is why should I continue on meds, and what experience will I have if I discontinue meds? So
well,
what experience?
discontinuing meds is a big issue if you've been on meds for a long time, and it needs to be under a doctor's supervision, or under clinical supervision, because you could have a reaction, withdrawal. There's withdrawal symptoms. There is the fact that you're now experiencing life in a totally different way that you've never experienced it before, right? And we talked about that unknown piece that complicates things. That could easily throw you back into the hospital or into an unsafe space when you're experiencing life totally different. Maybe you'll start crying faster, or maybe you'll get sad faster, or maybe your thoughts will get more manic faster. And without a medication to stabilize you, you better know some really good coping techniques and self-soothing techniques, to mitigate withdrawal or symptoms reactivating. So, you run a risk by coming off medication. The benefits of staying on meds are, over time, you may be able to titrate down, be on less meds, and also you get to learn how to, you get to experience life in a way that usually is less disruptive. So it's risks and benefits. So I've worked with people that are on no meds and have schizophrenia, and they're just in a constant delusional psychotic state. They're not in the hospital because they're not unsafe, right?
But they're still
But they're
not
still thoroughly
functional.
psychotic and not functioning. They're just living in their apartments, shitting on the floor, and waiting for the ACT team to come to bring their food, or take them to the grocery store. You know, I mean, that's not a way of living. That's not the life I want to live. I don't want to live a life where I'm so sick, that I can't do what I want to do. When I set a goal, I want to achieve that goal. When I'm psychotic, the thoughts are so disordered that it interrupts any opportunity I have to reaching that intended goal. And I'm too self-assured and too proud to not meet the goals I set out to achieve and reach them. You know, I've had a lot of accomplishments in my life, and any sort of interruption to reaching my goals, I've always sought to eliminate from the get-go. And I think a lot of people do, right? When you see something interfering with your plans, you make sure that whatever that is that's interfering stops interfering with it. And without medication, people don't always have that opportunity, because it's an organic process. And it's not as if, it's not like you wash a car and it gets clean, and that's it. And you don't have to go through the mud again for the tires to get dirty. They will get dirty. It's only a matter of time, and it's only a matter of, time and energy before your symptoms reactivate. Like it's like any other, what's a good example? So like when you have trouble breathing, right? Or when you have,
Asthma.
let's say, asthma, right? You carry a pump with you, right? Because you know it's only a matter of time before you need it, right? So with schizophrenia, it's the same thing. It's only a matter of time before what's ever going on organically starts to, you know, start working, and you start getting confused and agitated again. It's gonna come back. It's only a matter of time. It's not like some other disorders where, there's not organic brain matter that's messed up and toxic. There are
So
certain
basically,
mental
you're
health.
saying, you're on meds today because you want to be functional.
I want to be functional, yes, and I want to be the best me I can be. And while I may be 40 pounds skinnier, without meds today, or 50 or 60, I'd be locked away in an institution or in a persistent delusional state, depending on state services to come and make sure that I'm okay on a weekly basis. You know, we have a lot of government programs out there watching people that, are either not taking their meds, or med resistant, right? And the meds don't help, and we just have to make sure that they stay safe. And we can't throw them in the hospital because they're not
Because
hurting anyone, and they're not hurting themselves. So what do? You watch them. And in where I come from, we have what's called, forced treatment, but we also have, underneath that is another level of care, where it's like a watch list, where these people aren't forced into treatment, but we know exactly who is right underneath that, status, who needs weekly visitation or monitoring, because they can easily escalate and become dangerous very quickly. So it's a difficult thing. It's a difficult choice. For me, it wasn't really a hard decision, because I know that I get psychotic very quickly, um, and that's with, stress. With no stress, maybe over a period of 6 months. If I'm really in a happy-go-lucky,
then you're gonna be
vacation-like
manic.
environment, yeah, I would still get manic and psychotic. It may take a little longer, but I will. If I'm stressed out and living a life where I'm working full time and all these things, I would flip right away. I'd flip it within hours, and become psychotic in hours. That's too risky, for me to say I'd be safe dealing with that without meds. I can't imagine what techniques I could apply. There's no deep breathing that's going to, help you in a situation where you're hearing, the Unabomber, or a voice that's saying, "There's a bomb in your apartment. It's going off in 5, 2, and you run out of the house naked because you think your apartment's gonna explode. That's not. I can't. That's not who I am. That's not the person when I grew up I wanted to be. And when I became that person, I said no, no, no. I'll do what I need to do to avoid that sort of situation from happening again. Um, I can see if you have mild anxiety, mild or mild depression, or some acute disorders where they're not long term, where you might say, I don't need meds because I can function without it. And some people can. But for long term chronic illnesses that are very severe, where you're literally in free fall and that plane is so unstable it's gonna fall out of the sky, take your meds, man. What are you doing? Like, you take your meds, why put yourself at such risk? Um, you know, that I the first talk I ever gave, okay, on mental health, I had a whole bunch of people in the room and I said, what is it? What do you think it feels like to 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 get sick with a mental health disorder? And I gave the example of a plane falling out of the sky. And I don't know if you know it, but when you're in a plane and it's going down, the people get in front of you and they tell you, they're like this: heads down, stay down, heads down, stay down. And they literally chant it so you make sure, that you stay in a safe position while that plane, crashes into a valley. And that's what it's like when you're in free fall. And when your symptoms activate, it becomes so severe so quickly that it feels sometimes like you're in a plane falling out of the sky, and you don't know what's going to happen around after that, because the outcome could be so catastrophic for your life and for the people around you.
And one thing I hear a lot is that people say that, well, I'm gonna be off mid until I feel it. But
True, and that's the problem, right? Because you feel it. By the time you feel it, it's too late.
that's it.
It's too late. It's too late sometimes. And by the time you're manic, you're so manic that you're already taking off into the sky. You're playing left. You're on the way to the moon. You know what I mean?
And you will not catch it. And even if you catch it, it's gonna take a lot of time to work.
And they take time. Yeah, they do. And you better have them on board and right next to you, and not at your friend's house. You better know where to find them, right? And you better have the right ones and take the right dosage, right? So, like, it's
That take a lot of
tricky,
time.
very tricky. I don't know if you went into your line of work to know how to understand your illness better, as a clinician, or but that's why I became a social worker and a therapist. I was en route to become an English professor, all right, and I was studying language and words, and I got into all that. But when I became symptomatic in college and had my quote break from schizophrenia, I knew that if I ever went back and wanted to both manage my illness and live a normal life, I would have to become a clinician to both treat myself and treat other people. And it's been helpful in the treatment of other people. But it's also been helpful for the self management of my own illness, right?
That's great
How
to
do you
hear.
manage? It's good to hear, but it was vital in my recovery. If I didn't understand my illness in such a nuanced, complex way, I would never have made it as far as I have today. There'd be some unknown, right? Something that triggers me that I wasn't aware of, that would send me into free fall, and again and again. And the more relapses you have, right? The less likely you are to recover as fully over the long term.
I
And
want to
it's
repeat it, please. I want you to repeat it, please, again, so people
the
can
more the
real.
more relapses you have over time, the less likely you are to recover fully from your illness, and manage it well over the period of a lifetime. Because what happens is your brain, every time you relapse and become manic or psychotic, more brain cells die. More brain cells die. There's more damage done to the brain. And when you have more damage done to the brain, how likely are you to take care of yourself, right? And function as well as you like to, um, you know, through your life? A lot less likely. More
True.
damage done to the brain, the more dysfunction you have in your life. the harder it is to understand what's going on with you in the world around you.
But that doesn't mean that you're gonna give up because you had so many episodes.
It's true, but it's a reason to make sure that you do what you need to do to not have as many sometimes. Like if I kept going off my meds, I would have more episodes and I'd relapse more. So that's why I stay on my meds. And that's why I adhere to my treatment, because I know if I adhere to my treatment, I'm less likely to unravel. Now, if you are relapsing and just relapsing because of breakthrough symptoms that just coming along and happening to you, and you have no control over it, just stay, keep your heart in the struggle and say you're going to fight on, because that wasn't your doing. You didn't create those symptoms. They just happened because your illness is that severe. But it can always be worse. You can have breakthrough symptoms and not take your meds. Then you're in an even worse spot, right? Then you're in an even worse spot. So, like, think about what your symptoms are. Think about what these experiences are like for you. When you're managing your illness, you want to know what every symptom, right? And how you feel on a day-to-day basis, on a moment-to-moment basis. Are you less tired? When you eat, your metabolism? Think about your bodily health. How does hydration and nutrition play into how you feel? When you have so much going wrong with you, it's time to start taking better care of yourself, right? So, like, when I mentioned that broken down car that takes all the repairs to fix, well, you don't let that car idle, right? You don't run into the ground, and you take care of that old car, right? You nurse that old car, make sure it can still get to where it needs to go. You know what I mean? And that's what it's like when you have a lot going on with you. You have to start being really, really attentive and really careful with what's going right. Because I don't know if you remember the movie Apollo 13, or know that story. The spaceship was breaking down. It was an explosion. The guy who was in mission control said, all right, what do we have left on this spaceship that works?" Right? And it was a very brilliant comment, because he needed to know what still works, because there was so much going wrong that when you focus on all the stuff that's going wrong, you're never going to figure out a way out of your issues. So you have to start thinking about what still works and what you could lean on in your life to keep going and moving forward. Yeah.
So let's go
How do you?
back to the. So let's go back a little bit. How did you break the news to your family that you had uh, bipolar or a schizoaffective disorder, and
Well, I didn't have
how
to
did you break it to yourself?
before I did. They knew before I
Hmm?
did, and most time that's usually the case. Most people don't break to their family. It's not like coming out, with your like a sexual orientation. It's your
Let's
coming
not
out
talk about that.
story.
Let's not
Right,
talk
right,
about.
sure. It's not like that sort of thing. It's not an act of revealing. People know. People know, and they know because your behavior changes, and you don't realize your behavior is changing, but other people around you do, right? You ever act a little funny one day because, like, maybe you were upset about whatever, and you didn't realize you were upset, but people did, you know, just like schizophrenia. They're like, oh, he's talking to himself. Maybe there's something wrong with him, and I didn't know I was talking to myself, but they saw me talking to myself, so obviously there is an issue.
So how should person manage their new diagnosis when they are shocked, when they are in denial?
Oh, okay. So, like, okay, all right. So, okay, yeah, we'll talk about that. Should we roll back on? We're rolling.
Yeah. Okay.
So yeah, so denial, not understanding, and not knowing you have an illness. That there's a term for it, anosognosia, and that's not knowing you're sick, but you're sick. And with schizophrenia specifically, and a lot of psychosis, people that suffer from psychosis, they don't know they're sick, but they are sick. Not knowing you're sick when you're sick, and it's a symptom of psychosis and schizophrenia, and it's very troubling because people don't know they're sick when they are, and it's usually the people around them that know first, their parents, their family, their friends, and convincing them is a very difficult thing, and you usually can't. You usually have to allow people to first understand that maybe they're not sick, but they're not able to do what they used to do, and not able to do it the way they do it without getting into trouble or arrested or any number of bizarre circumstances. Like you're like, wait a minute, I used to be able to go to the grocery store and shop without misplacing my car and crapping my pants in aisle 3. You know what I mean? And then when people start to realize that, oh, wait a minute, maybe there's something else going on, they'll seek help, and hopefully they'll get the right sort of help. They'll be connected with a psychiatrist or a therapist rather than some alternative treatment that's not going to treat what's really happening. But I've treated people with schizophrenia that were so convinced that they weren't sick, but yet we were still there treating them. So how do you reconcile that? Well, we're here to help. And you turn the treatment into, we're not here for your schizophrenia. We're here for the fact that you're not able to make it to the bank without getting arrested. So we're going to help you with that piece of your life. We're not helping you with your schizophrenia. We're helping you with whatever's interfering with you meeting your goals on a daily basis and function like you used to. And then sometimes people are more apt to buy into that sort of help than thinking it's for a disorder or for a major condition that's really could be very difficult to accept. So people first have to accept help, then help with what's interfering with them. Sometimes before they get help with that huge piece, which is really what the issue is. Does that make sense?
So it does. So a question we hear a lot in our community is how to manage an episode, either depression or mania, or either psychotic episode.
So, it's great. I'm glad you mentioned that. So, I recently wrote this piece on how to manage self-mania for NAMI and the National Alliance for Mental Illness. It was a blog article on how to, manage your mania symptoms. And, there are ways. There are ways of managing mania. There are ways of managing psychosis. A lot of it, though, has to do with your ability to understand these symptoms as symptoms that are problematic. So, like you said, sometimes by the time people realize they're manic, they're already too manic to get help. You know what I mean? They're on the way to the moon. That spaceship's not coming.
They don't feel the need to help.
Yeah, they don't feel the need. So they let it go so long that when they finally get treatment, they need to be in the hospital for 6 months instead of 2 weeks. But how do you treat and manage these symptoms? Well, you manage them like any other thing in your life. When you're feeling too excitable and too or too edgy, you work on your anxiety, or you work on your frustration tolerance. If you're getting too upset with people too quickly, you learn how to cope with more stress. And it's really, there's no magic wand, because like all these symptoms are so personal. But for every stressor and every symptom that's interfering with you feeling okay, there's a way of there's a therapeutic intervention that's going to help with you feeling a little bit better. For example, a lot of my issues with schizophrenia isn't that I hear voices now. I don't, because the medication helps with that. But what the medication doesn't help with is my the fact that I'm sedated a lot because of the meds, or that I'm aggravated or irritated, that I can work less. You know what I mean? So I go to therapy to feel better about my work situation, or learn how to get a job that fits with my illness a little bit better. I'll work from home, or I won't work around as many people, or I'll learn to eat better so I'm less bloated. There's no magic wand, but there's always an intervention that's going to help you with whatever it is you're experiencing in the moment. You just have to separate out each symptom and separate out each experience and treat each of these things as much as you can. Because when you throw give you an example. When you have a lot of flavors of ice cream, all right, and a sundae, and you're eating it, you don't even know what flavor you're eating at some point. Is this vanilla? Is it chocolate? It's kind of mixed, you know. How do you treat an illness, okay, when there are a lot of symptoms going on? You have to make sure that what you're treating is what it actually is. So, for example, when I went to the hospital because I thought I was having a heart attack, I wasn't having a heart attack. I was having a panic attack. They gave me the wrong meds, and I wasn't. As a result of that, I got very sick and sicker. So you want to make sure that, over the course of time and over the course of managing your illness, you learn about all the stressors, all the symptoms, all the interferences, and how to alleviate each of these symptoms without them colliding and becoming too complex, too ornate to untangle before that snowballs out, becomes a more serious issue. Yeah.
So, a question that I always ask myself is, am I the one who did the stupid things you did while you were manic? Or is it me, the one I'm manic when I do what I did as a manic person? Or is it something that's not me?
I think it's a little of both. I think that we all have impulses and we all want to do things. And I think that when our thoughts are more clear and that filter is in place, and you're thinking clearly and you're less impulsive, you're more likely to make a better decision. So let me give you another example. Remember that spaceship Apollo 13 that we talked about? So there's a scene in there that I show everybody, all my friends who deal with mania or needing to make changes or the right decision, put their life back on track. It's called where they had to do a corridor control manual burn. So the spaceship wasn't pointing towards Earth anymore, and they needed to correct it so the spaceship was back in line with reentry to Earth. So there's a scene where they shoot the rockets, right, and burn the engines, and they're dancing all over the place, and finally they're right back on course. So for a lot of us with mania, sometimes we're so impulsive and running around that we're not going to make maybe the right decision. And it's going to take a real big concerted effort to realign ourselves with the right sort of decision making and judgment, so that impulsiveness, right, from a seemingly benign and okay thought doesn't become disastrous. Because a lot of us just want maybe, I had the other day when I was manic, I wanted to smoke a cigarette, but I was so manic that I couldn't hold it in my hand and it fell down, and then my pants caught on fire, and I'm like, wait a minute, am I so disordered that I'm burning myself? No, it's because the thought's fine. I just want to smoke a cigarette. That's an okay thought for me, but my thoughts are so speedy, and the way I'm handling myself is so disordered that even that okay thought becomes problematic, because what I think I'm doing and what I'm experiencing are no longer congruent.
That's very delightful. So we hear a lot that in order to get if you got diagnosed, that's the end of your life. You cannot pursue your career anymore, because at least that's a thought that came to anyone who got diagnosed at later age. So did the diagnosis stop you from pursuing your careers?
Well, I made a career of my diagnosis, but that's just me. Not everyone does that. Some advocates do. Not everyone does. Here's the thing: who knows that you have a diagnosis, right? Your diagnosis follows you up here, unless it's pinned to your back, right? Or a scarlet letter is written into your vest, that a big S for schizoaffective disorder, or a big, no one knows that you have these illnesses. They may be on a document somewhere in a clinic or floating in an EHR system, health record system, but no one knows. Your diagnosis follows you as long as you let it follow you. And it becomes problematic when you start to believe that, what's written on paper and what may be, a health issue for you is going to overtake and become who you are, right? With someone with diabetes, doesn't throw their hands in the air and go, oh, that's it. I'm never ever going to become the mechanic I want to be. I have diabetes. There's that big D on their shirt. No. They manage it and figure out a way around it and realize that it's just a diagnosis on paper. It may speak to a whole host of issues for them, but as long as they're able to handle it and find a way to take care of it, so it's not interfering with their life, it's just like anything else in the world. It's a flat tire that needs to get repaired, right? You keep going. After you get that tire repaired, you don't just sit there. You drive off and you go to your final destination.
So, a message you want to give to everyone who's just newly got diagnosed?
Sure. All right. So, newly diagnosed with a chronic long-term illness is a very difficult thing. But you're in a place when you're first diagnosed of opportunity. A little bit. It may not seem like it, but the great thing about folks like me is now, as opposed to 30 years ago, is we have meds now, right? With better meds and better knowledge and information. And people today that get diagnosed are able to eat better, tolerate meds better, and protect their health better. So they're not, 50 years old and keeling over in an adult home. They have a real opportunity to take care of themselves as best as they can early on, so that weight gain doesn't turn into diabetes, and that diabetes doesn't turn into a heart attack. You know what I mean? Yes, sure, there are disadvantages, but you have to make sure that your protective factors and your ability to heal and self-manage outpace your symptoms. It's a race, and it's a race against time. It really is. And our lives are a race against time. So the sooner you take care of what you need to take care of before you expire, the more likely you are to succeed in whatever it is you set out to do. Whether you're an advocate or someone that just wants to take care of this schizophrenia or bipolar disorder and be a mechanic or a chef or do whatever it is you want to do, just make sure you take care of your health. Because without your health, and it's not the diagnosis, it's your health that fails. Your diagnosis doesn't expire, you expire. So take care of your health, and it's just critical. And it's it's going to make the difference if you take care of it earlier on in your chances for survival and success. And that goes for people with or without a diagnosis, right? Even if you don't have schizophrenia, if you don't take care of your health, you're never going to graduate from college, right? You're going to drink yourself so much that you don't ever make it a senior year. And if you have schizophrenia and you don't take care of your symptoms, you'll be so psychotic that you'll end up in a state hospital before you graduate. Either or, your health is crucial. So be mindful of whatever it is that's interfering with you being the healthiest you that you can be.
So, as one who wants to be an advocate, do you have an advice?
Yes. My advice to all advocates and people out there that want to learn and help and shed more information is to be the healthiest you possible before you get out there and start speaking up. For a lot of reasons. Because one, once you're out there, and your health is out there, and your health status is out there. So, I don't have the opportunity to, go into partial hospitalization every other week because I'm sick. I have to take care of my health, because my word is now healing advice and recommendation for people out there who want to get better. People that want to get better don't want to listen to a person that doesn't know what they're doing with their health, and that they're getting so sick every time because they're really not healthy, right? You don't go to a person who's on the brink of heart failure for advice on how to take care of your heart, do you? No, you go to someone who's seemingly healthy looking, who's seemingly taking care of themselves, and that component of their wellness is good. I worked with a lot of sick advocates, unhealthy mentally, and who have attacked me just out of because they're sick that day. and I've had to deal with that. It happens in mental health all the time. Sick advocates attack each other. There's infighting, nasty stuff said because they were not feeling well that day, or thought that it's okay to rant and rave in a 50-page email about stuff that never happened, and then apologize the next day. And a lot of organizations and agencies will excuse behavior because people are working on it, so it's okay if they mess up. But once you give someone the license to to slip up and it be okay, you excuse any opportunity that person had to take any accountability and responsibility for their symptoms. So my advice to all advocates out there: know yourself, be healthy, as healthy as possible, and if you do relapse, own it, know why, so you can pass on that information to others. Oh, look, this didn't work. That med wasn't good for me. This is how I knew, and this is how I could go out there and feel better and do better.
And a message to the family of the disordered people.
Message to the families: this is a lifelong illness. These are lifelong struggles. Family is lifelong, right? At least I hope it is. For people out there, my parents, I've written about my parents a lot because they have been there through all of it, and they're still there, and they'll always be there. And my success and my ability to be here right now talking to you folks is because I've had supportive family and parents from the minute I got sick, and hopefully they'll never leave my side. And the times that I get really distressed and upset are when I think of them leaving me because they're disappointed with I'm not getting better, or they just whatever. And they're getting older now, my parents, and they're in their 70s, and they're not 60 or 50 anymore. They're not out there, and it's harder for them to see me get sick because they can't help me as much. So it's all the more reason for me to be as healthy as I can, so they can see me in my health and know that all their hard work and dedication to keeping their son healthy and keeping him safe was for a reason, because now he can take that information and that measure of safety, apply it to his life, and they can look and say, hey, look, he may have had schizophrenia, but we helped him, and now look at him, he's surviving, and we can be okay and at peace with ourselves when we move on and pass on, and know that he'll be okay. And to all the families out there that give up on their families or family members, sometimes toxicity is a thing. Sometimes personality disorders are what they are, and we have to just be careful of people in our lives. But for people that really love each other, and when family struggle is a result of a psychiatric symptom that could easily be treated with a medication, or is just a direct result of not feeling well, know that pain is real. Psychiatric pain is real, and we don't treat pain by a cold shoulder or giving someone the middle finger. No, we give them a hug, and we nurture them, and we surround them with support, and good support is family, friends, people in your life that know that this is a lifelong struggle, and they're not gonna abandon you halfway through it. And if they do, you'll have all the support you need from everyone else to keep going, because you'll know what real support is. So be a real support. Be a good support. Be a good support.
What about friends?
Friends. So friends have less of that feeling that they have to do things, right? Because they're not family. And I've had a lot of friends that walked away. Friends that continue to walk away, still do, but I have friends that are still there from the minute I set foot on my recovery. And it's interesting who stays and who doesn't, why people leave, and when something's too much. And the best thing I can say is that you have to be you. Okay, you can't be a false persona when you're sick. You're usually sick, and when you're very sick, or as sick as I am, You don't have the energy to be somebody else. You don't have the energy to be who your friend wants you to be. You know, you have to be who you are because you're so sick that the real you is going to shine out anyway. So let it shine. Let the real you shine, and let it shine. You know, throughout the course of your friendships, and when your friends find that bright light, that relationship isn't bright enough, and they want to walk away, let them, because you know, there'll be a better memory than they will serving you as a cold friend when you really need the help and support that this illness calls upon sometimes.